Today we will be presenting our project e-garments for health monitoring in Metaverse. Metaverse is basically a combination of augmented reality and virtual reality and Internet of Things. It is basically an element or component of Web3. Since many years, patients have to visit the doctors in the hospital locations for getting their treatment done. But with Metaverse, people can virtually visit the doctors irrespective of their geographical boundaries or locations. So our purpose of the project is to design a garment with 4 sensors for temperature, pulse, oximeter and gyroscope. And the patient will be wearing this garment, and then it will be virtually seen by a doctor, and the doctor can diagnose the patient virtually and give the diagnosis to the patient. So our garment is basically cotton. So we are using cotton material to prevent electrostatic discharge or to prevent short circuit for the patient, because our sensors are embedded into the garment. So to prevent short circuiting, we are using cotton material. So now the purpose of the project is basically we are using the garment mainly for the rural areas, for people who are inaccessible to hospitals or who have to travel a lot of distance to reach a hospital. So basically an old age woman or a woman or a girl can wear the garment, and then they can virtually show themselves as an avatar. They don't have to use a camera or anything. Their body or their face will be shown as an avatar form to the doctor, and then the doctor can see the real-time data from the sensors which are embedded in the garment. Thank you.
My name is AISHWARYA. I'm from the Biotech department. So I'm working on this project e-garments for health monitoring in Metaverse. So basically our project has been designed in such a way that it is helpful for the common people all around the world. So here we have designed a garment with sensors embedded in it, which helps to record the health parameters like the temperature rate, pulse rate, as well as the body temperature. So here the doctor need not visit the hospital. He or she can directly visit the patient's house, and the patient need not go to the hospital. So both of them, they can interact in a virtual 3D space, and the doctor will be able to record all the health parameters with the help of the virtual environment. And it is also helpful for the aged people, as well as for the women out there who are not able to, who face difficulty in traveling, and even nowadays, as you all know, there are cyber bullies happening. So just to avoid all that, you can actually, especially I'm talking about the ladies, so they need not visit the hospital late night. They can just stay in their house, and they can just fix an appointment, and the doctor can actually visit their house and he can actually consult. So that is what our main idea is about the project, and we have used 4 main sensors. The first sensor is the temperature sensor. As you all know, it is to measure the body temperature. Then the second one sensor we have used is the pulse sensor. It is basically to record the pulse rate. And there are 2 more sensors, which is the oximeter as well as the gyroscopic sensor. So the gyroscopic, it is to actually know the orientation and movement in a 3D space of the patient, because we need to know the posture and the movement. Only then we will be able to detect all these parameters. Then the last one, that is oximeter. It is basically like the pulse sensor. You can actually record the oxygen level of the patient as well as the pulse rate. So back then and even now, the present time, the patient usually goes to the hospital and visits the doctor and consults him, asking him if he or she has got any disorder or any disease. The doctor will directly face-to-face be able to talk to the patient. But in our perspective, what the future is like a 3D virtual space which we have created. So here the doctor will virtually come to the patient's house. The patient need not go to the hospital, and the doctor will actually through a virtual space, he can actually see the patient and also check the health parameters and also record them, like the body temperature, pulse rate, and even the oxygen levels of the patient. So even after one consultation, he need not wait for the next patient. He can immediately consult the next patient after one. So that is our main idea of the project.
Hi, my name is SNEHAM NAYYAR and I am from Data Science and Business Systems Department. I am in charge of the software and hardware part of the garment. So, as we all know, there are many wearable devices available in the market which are quite expensive, which shows the health parameters of the person, but as I said, it's very expensive. So we have come up with a garment which has all the sensors included, which gives the health parameters, as well as it's very cost effective. So we are basically focusing on the rural part of the country where the people cannot afford the these expensive devices and everything. So we are going up with the non-invasive parameters, and there will give all the parameters to the cloud, where the doctor can come in the metaverse, where he will just click on the cloud link and he'll get all the parameters of the person, and he can give the prescribed medicine prescribed as per the parameters which will be there in the cloud. And then it will also keep the privacy of the person intact, as some people don't like to show their faces or anything on the video call as well. So we are going up with the metaverse part. Thank you.
Here's our product, namely e-garments. So basically we have the pulse sensor, temperature sensor, oximeter and the gyroscopic sensor. We have embedded it in such a way that they'll give the direct health parameters of the body when worn by the person, and it can also be used by elderly people, where they can wear it for 24 hours and it will show the past 24 hours value of their health, and it will help them tell the doctor that okay, this is something or the medical issues they are having. And for a business perspective also, we can give it to the sports persons, where they can also wear it while practicing or training, and it will help them avoid any injury or something. We have used both digital and analog sensors here to give the accurate value of the parameters of the person. Thank you.